Hi, I'm Jennifer Taniguchi, and I'm an orthopedic surgeon here at Glacial Ridge Health System, a center for surgical care. And I'd like to talk with you today about rotator cuff tendonitis, otherwise known as impingement. Rotator cuff tendonitis is a diagnosis where you have inflammation, irritation of the muscles and tendons around your shoulder, which is the rotator cuff. And it can be quite painful and annoying. It often happens in people of almost any age, from younger, in your even late 20s, up to older people, your 70s or 80s, and it can come on for no reason at all. Or it can happen after you've done some increased activity with your shoulder that's typically repetitive, such as painting or moving. Usually you find that you have pain at the side of your shoulder, and that's where the rotator cuff muscles send their nerve fibers to. And it can bother you a lot when you're trying to lift your arm up or reach out to the side. It can also cause a lot of problems with sleeping, especially getting comfortable and trying to lay on that side can be quite painful. As far as treatments you can do on your own at home, if you're feeling these symptoms, those would include rest, or trying to avoid the activities that cause you to have more pain. Also, anti-inflammatory medications such as ibuprofen or aspirin can help. Otherwise, if you're not able to take those medications, you could try Tylenol, and those are all over the counter. Just take it as directed on the bottle. Ice and heat can also help. Ice is really good for severe pain. It just helps to numb up the area, and heat's good if you feel more of like a muscle spasm or a muscle pain, because that helps to relax the muscles. And usually I recommend maybe 20 minutes on, 20 minutes off, and to protect your skin with a washcloth or something like that so you don't get frostbite or a burn. You could also try topical treatments like a muscle rub, Tiger Balm or BioFreeze, and that can help as well. And just give it some time. Rotator cuff tendonitis can take 3 or 4 months to go away, even with treatment. And then if the pain is really severe or it's persisting for a month or so, with you trying all those things at home, that's when you'll want to be seen. And I'd be happy to see you for any shoulder issues. When you come and see me, we'll typically get x-rays to start with, so I can look at the bony architecture to see if you have any arthritis or bone spurs or anything else that can be causing problems. And then talk to you for a while about what's going on with your shoulder. That oftentimes in of itself gives me a really good idea of what's going on. Asking more about your shoulder pain and where it's at and when it bothers you. And then I'll do an examination where I take a feel of your shoulder, see what your motion is like, your strength is like, where you have pain. And all these things put together help me to figure out what's going on and to diagnose someone with rotator cuff tendonitis. And oftentimes I start off with non-operative treatment first. Same things that we mentioned before. If the pain is really severe, then I would recommend an injection of cortisone, which is putting the anti-inflammatory medication right into the area. I usually go from the side of the shoulder above the rotator cuff where the inflammation is occurring. Physical therapy can also be really helpful as well, as they can do some other treatments to help decrease your pain and also help you with exercises to stretch and strengthen your shoulder. If the pain still persists with these treatments after a few months, then I'd go on to getting an MRI, which is a study that gives me more detail about the soft tissues and about the rotator cuff. And then at that point, I'm usually thinking about surgery to see if I can clean up anything in the shoulder that could be causing inflammation, such as a bone spur or even just getting rid of the inflammation. And this is usually via shoulder arthroscopy, which is a minimally invasive procedure I do with small poke holes around the shoulder and a camera to look inside. And typically after surgery, it still takes a few months to recover.